Hello, my name is Damian Mingle. I'm the Chief Data Scientist for WPC Healthcare. Today's webinar is going to be about 15 minutes, 15 or 20 minutes, and we're going to be talking about the Zika virus today and the data science opportunities that are potentially there. So first things we need to do is we need to kind of understand a little bit about what's going on. Zika right now is a global problem. New York Times and other major publications are filled with stories about the threat. Even the Pope has come out recently and said that Catholic women in Brazil can use birth control. This is the first time in history of the church that this has ever really happened, so it's kind of a big deal. And then the CDC, Public Health here in the United States, has been putting out a lot of facts here recently. So some of the information out there right now is that really the first case that was reported in Brazil was in May of 2015. And prior to that, the Zika outbreaks were in Africa, Southeast Asia, and the Pacific Islands. And the Zika virus is going to continue to spread, but the problem is people don't exactly know where. So that becomes part of a bigger puzzle. But even in Puerto Rico and U.S. Virgin Islands and America Samoa, a lot of the local mosquito-borne transmission of Zika are already occurring. So what's the role of data science? Well, the concern has expanded from just the impact of bites, mosquito bites, to the amount of pesticides causing birth defects. So um, the question is, how is this being managed? And typically, the way most groups do it is they, of course, do some carpet bombing with pesticides. If you can think about napalm, for example. Um, and there's some evidence out there that this is actually causing birth defects in other countries outside the United States. You know, a lot of municipalities manage this to the best of their abilities, but they do it without any kind of active, systematic way of rolling up data and then really sharing their findings, sharing their data in a way that actually helps people. And so what ends up happening is you kind of get this siloed effect, which probably resonates with some businesses. Um, the answer really is coming down to, in our belief, a data science algorithm can absolutely help the country offices and international partners more efficiently and effectively um, by allocating resources the right way. And the idea here is to prevent the transmissions of this potentially deadly virus. So, in short, this is a better, faster, cheaper technique than what's currently being deployed. So we did some work with the West Nile virus. WPC has already delved into the public health through our work there with the West Nile virus, which is another major threat with no treatment at this time, no real cure. Um, we presented a data science-based approach at the 2015 Third International Conference in Sri Lanka this past December. And the data was collected by the city of Chicago over several years. We looked at surveillance data collected by the city, and we blended weather conditions or climate data with the original data, which presented some interesting findings. Here is a comparison chart of the current methods. You see on the right side kind of random spraying. This is kind of the approach that's taken today. Nobody knows which mosquitoes has any of these kind of issues, whether it's West Nile virus or Zika, so they spray everywhere. They like to think that there's a certain couple areas that might be more interesting than others, or there's somebody reporting a lot of mosquito activity, so they're going to spray in these areas. But for the most part, it's pretty much random. So what this West Nile virus algorithm did was actually take into account various features and attributes and really tried to become more layers of focus. So if you're going to deploy people, if you're going to deploy pesticides, then let's try and be more smart about the situation and try to be very focused, very laser focused, and not expend a lot of effort and, of course, help outcomes. So the way we did this, we portioned the data using statistical standards to develop a training data set and a testing data set. In other words, we basically partitioned off the data, segmented the data in such a way that we actually created for ourselves kind of an unknown situation, which is real world. All of our approaches here at WPC Healthcare are very applied in the wild or an applied data science perspective. So we kind of get out of the test tube, if you will, into the field. And we've developed a more robust model because we're able to do that, but also we also use to count the number of mosquitoes trapped in the surveillance mechanism, and we were able to use that location where those traps were, in addition with nearby locations and also climate data. And the confidence in this prediction is about plus or minus 3%. So even with that kind of variation, it's still a pretty huge win over what's currently being deployed today with random sample or with random spraying. Excuse me. So let's talk about data. What can we do to supplement the data? Um, you know, in cases like Zika, even in West Nile virus, there's just not a lot of data to go around. Um, and so the ability to be able to generate data for what we call the data potholes is a very big improvement over traditional methods, even for individuals who might be used to regression analysis and those sort of things. Um, Getting the additional data in there or kind of filling in the areas that are problematic are usually a big help. Um, well, I'm going to walk through a little bit of how we did or what we would generating the data from data potholes or generating data for the data potholes that one might experience is a really big and powerful technique. A lot of healthcare data, in particular, that's the space we're in, very messy. You might have Tommy who does really well with blood pressure cuff measurements, and Jane may not. Or there might be some sort of new policy that was misunderstood, and so people are doing different things. And you start to see all these switch points in the data. And so to get some sort of consistent data, is really difficult. So being able to go back and kind of perform the right steps, the right techniques to fill in those potholes is really advantageous for many solutions that we create. Um, and the other thing is, whenever there's a lock on the data, like there is with the case of Zika, it makes sense to use proxy data. So what that means is you want to try and simulate behavior as best you can. So if we don't have all the data for Zika, or we don't have enough data, what can we do to kind of create a proxy situation? And here's why this matters. And because in the truth, having an approximate answer to the right problem is better than nothing at all. And that's really what we're talking about here. This is a really interesting visualization. What you see is it's an example of how difficult this mosquito problem is. Now, this is the case of West Nile virus. I wouldn't expect it to be too much different than for the Zika virus. But here what we did was we absolutely separated the mosquitoes without West Nile virus, which are the green, against those with West Nile virus, those are the red. So that sort of thing is how the machine starts to take a look at that. Um, the way the humans see it, of course, is with the red and green smashed together on top of each other, and it complicates the pattern for even the best human experts in the world. But when you're dealing with algorithms, training the algorithm to be able to see this sort of specificity and distinction, you really can get new information, new insight that actually is usable. Okay, so here we can see, there's some differences, of course, in West Nile virus and Zika. A lot of it has to do with the timing of the mosquito, when they feed, when they don't feed, what makes them a little bit more unique. But it's really what's really important, and this is the same sort of process we go through with many of the data science approaches we have. We try to ramp up as best we can by using the best scientific literature around whatever, let's say, a condition is, in this case, Zika. And then if it's not Zika, because there's not a lot out there, maybe we go to West Nile virus. We start to try and leverage what's known from the best minds that have been published. And we once we have that kind of expertise available to us, we then start to map that to data science attributes, and that helps us to define the target, and it helps us to bridge the gap from similar situations that are not exact, but again similar, which have value as well. I think what's really important here is to recognize that this talk is really not about trying to solve when a person gets bitten. I mean, that's really medicine's job. What we're attempting to stop, though, are the bites, which are much further upstream um, in the process. You know, we work with our partners to become proactive instead of reactive, and that's indicative in the solutions that we generate, including this particular solution. So um, that being said, you know, WPC really takes a lot of unrelated data sets and maps those back to the targets that we have in mind that we're looking for. And um, in the case of mosquitoes, we're looking for. So W so WPC takes unrelated data sets and maps to targets that we're looking for, which in this case happens to be mosquitoes. Um, and you take the climate data, for example. We found connections there with the data. We enhanced the data, we enriched the data, so it became a predictor for us. A lot of solutions would just kind of overlook this sort of thing, but we really do take advantage of kind of the unrelated data sets to drive decision making. One of the goals here is to reduce the cases and find ways to treat it, obviously. In many ways, we've not done much more than Snow did in London with the cholera outbreak in 1854. In absence of data, he went out to the residents and started collecting data about deaths relative to the city or the town well, and found massive connections there. Again, unrelated, wasn't popular at the time, but it certainly became very popular once the solution was made known. So being able to create synthetic data sets are very, very helpful, especially when there's a lack of sharing the data. Sharing the data, um, sharing the data, being able to help Brazil and utilize scarce resources more intelligently seems like a real win, and hopefully the approach that the world will end up taking. So a lot of times we get asked, especially when we start working with mosquitoes, how does this strategy really relate to hospital issues? You know, such as, let's take sepsis, for example, hospital-acquired sepsis or some other kind of harms condition that a hospital unintentionally makes. Um, and so, you know, the situation is that these are really, really difficult problems that we're working on. It's a way for us to demonstrate um, how we can best make solutions. So it's kind of, it may not be apparent, may not be readily apparent, but what we go through is the same sort of process, whether we're working on global issues or issues for our partners. We go through the same sort of process. What do we want to know? You know, what do we have today? What kind of data do we have today? What's already being collected? What do we need to generate? What kind of data needs to be generated or cleaned up to become more usable? And other questions might be, do we need to layer the data with something else to kind of make it come out, stand out a little bit more so that the signal rises to the top and we kind of diminish the noise? We go through statistical procedures where we try to design a proper validation set, and this is a big deal. This step is a very big deal. A lot of research out there today deals with what they call in-sample testing. So for example, if I had 10 mosquito cases and 3 of them had the Zika virus, and I trained an algorithm on those 10 cases, we would hope that the algorithm would be smart enough to get those 3. And a lot of times they do. But if you think about that, that's not really the real world. The real world would say, let's randomize those 10. Let's take 7 of those randomly and train on them. The other 3 we're going to put to the side. We're not going to look at. When we finished our model, we feel like we want to go ahead and test it against an unknown situation, which is what will happen in the real world. Then we'll go ahead and run that data set through, the test data set, the validation set. So in doing that, that simulates what will happen in the real world, and that sort of thing is incredibly valuable. But a lot of researchers miss that step, and so a lot of the models that they create end up breaking down. We're ultra sensitive to the fact that these are operationalized data science algorithms. So rather than theory, we're actually trying to deploy this, which is a different focus, a different approach, but certainly one our clients find valuable. Other questions you might have would be, what's the right measure of success? So we work with um, uh, experts and our folks as well to be able to kind of break that down and make sure what we're doing makes sense. And we do this in whether it's clinical, operational, financial data. So um, this same process that you see here is exactly what we go through with our clients. Here's some other interesting information if you're interested in West Nile virus or mosquitoes in general. This sort of stuff really did help us. This is sort of literature we were talking about that actually informed a lot of what we were doing. Um, and we actually incorporated it into the model that we did that we showcased there in Sri Lanka. Okay, so we have a few questions here. Let's see, I'm just going to read these here. When we have so much healthcare data in the market, why is data around Zika so difficult to obtain if we've known about it for 7 years? Well, specifically in the case of Brazil, there are some legal issues about releasing data on their citizens. So that presents a kind of a different discussion, different webinar. But in general, there's a lot of data being collected in healthcare, but sharing is still a major problem. I'm a strong advocate for what is called open data or open science. And this simply means that I'm interested in freeing the data so that we can advance humanity. It may not be right per se, but I feel it is the right thing to do. So a lot of times businesses have a difficult time with that. And there's processes to work around that through de-identification, that sort of thing, without disturbing the distribution of rows or records or what have you. So again, I'm a big fan of that, and I hope that that changes. I hope that sharing becomes in vogue, if you will. Okay, let's see. There's another question here. What enhancing data might you add to create more accurate outbreak predictions beyond the actual mosquito trends? Okay, that's an interesting question. I guess immediately, well, borrowing from from our learnings from the West Nile virus, I would look at climate data. That seems to be pretty interesting. I like matching up data sources in the sense that synthetic data sources or system generated data and natural data sometimes don't go together, but like climate data and a mosquito, since those are both more natural, kind of makes sense to me. That's the way I view that. I'd also look at the pesticide spraying data. You know, when they did it, how much they did. Um, that's going to be very interesting. I think that could provide interesting ideas for researchers to work on while the rest of us are trying to wait for a formal solution to this problem. Um, let's see. Here's another question. I'll just do this last question here. How can an algorithm like this help with an issue like sepsis? Okay, well, my apologies if what I said was confusing before. The sepsis example I provide is really an application of the data science process that we mentioned today. Um, if you think about Zika, hospitals have a very difficult time as well answering a lot of the questions that they have with or without the data. And in the case of hospital-acquired sepsis, it's a rare event, much like the Zika virus. Um, Groups, our group, discovered a way to be able to take this same data that hospitals have been collecting for years in the regular course of what they do with their patients, and without physical assessment, so things like blood pressure or taking someone's blood or height, weight, all that sort of stuff. So without that, and still be able to provide some sort of early warning detection of patients who could be in a likelihood grouping um, that they might in fact actually experience a hospital-acquired condition like sepsis. And this sort of solution is a really big deal. It's big because it usually happens at the point of registration. And if you think about that, think about the timeline of a hospital and when a patient comes into the door and they say they're sick, and then they go through all the various steps, waiting in the waiting room, for a long time usually, and then in the triage, and then they finally get to the back where the nurses work with them and so forth. It's a it's the right process per se, maybe, but it is very, very complex and it takes time. So what we're actually aiming to do with the algorithm, with the sepsis algorithm, is we're really trying to get in advance of all that sort of stuff. So most doctors don't know for 24 or 48 hours if their patient that's come in through the front door actually has sepsis, and they only usually do the conventional methods, which of course the blood tests and those sort of things. But that can take time, a lot of time. And so if we can come alongside, if WPC can come alongside and help hospitals or providers with identifying likely situations 24 to 48 hours ahead of time over conventional measures, it really does matter to the patient and to the hospital. So, um, in any case, I really do appreciate. We'll do a wrap on that. I really do appreciate everybody attending today. Um, if you have any interest in solving what seems like impossible problems with your organization, WPC Healthcare would love the opportunity to sit down with you, learn a little bit more about your business, your situation, and see how our group can help. Thanks again.